In addition to autoimmune testing, immunologic assays are used to detect infections through antibody or antigen responses. A common example are some things we already have learned: anti-streptolysin O or ASO titers, HIV serologies, and tuberculosis screening. These tests evaluate the body's immune response to pathogens rather than to self-antigens. We'll look at these principles, uses, and interpretation of these infectious disease assays next. The ASO titer measures antibodies against the enzyme streptolysin O, which is produced by group A beta hemolytic streptococcus. It's especially useful for diagnosing post-streptococcal diseases such as rheumatic fever or glomerulonephritis, which can develop weeks after initial infection. Because these are immune-mediated sequelae, the ASO titer reflects a past infection rather than an active one, and rising titers indicate a recent strep exposure. Following a strep pyogenes infection, the immune system produces antibodies that cross-react with host tissues due to molecular mimicry. In rheumatic fever, anti-M protein antibodies target cardiac tissue, which leads to pancarditis. In acute glomerulonephritis, immune complexes deposit in the glomerular basement membrane, which causes hematuria and proteinuria. The ASO titer helps to confirm this post-infectious immune response. The titers begin to rise about a week after infection. They peak between 3 to 5 weeks and they'll remain elevated for several months. A normal result is less than 166 Todd units or 200 IU's international units per milliliter. In post-strep disease, a fourfold rise in titer is considered diagnostic. Now remember that ASO tests confirm prior exposure, not active infection, and they must be interpreted alongside a clinical findings. Elevated ASO titers can also be found in rheumatic fever, 85 to 90% post-strep glomerulonephritis, about 50% of the time, and a strep skin infection, strep pyoderma, 30 to 40% of the time. Because antibody levels vary by infection site, concurrent testing with anti-DNase B may improve sensitivity. You always want to correlate serology with the patient's recent illness history and symptom timeline. When we come back, we're going to look at the spectrum of HIV testing.